Look before you flush, because there is one specific shape that keeps appearing in the toilet day after day that most people dismiss without a second thought. It doesn't cause pain, it doesn't bleed, it doesn't announce itself in any way you'd normally associate with something serious. And that's exactly what makes it so easy to miss. Most people assume digestive problems begin with pain, but many of the changes doctors pay attention to first aren't painful at all. They begin with changes, small ones, changes in color, changes in consistency, and sometimes changes in shape. Here's what I've learned after years of working with patients over 60. Some of the most important warning signs don't appear in the doctor's office. They appear at home, quietly, long before more obvious symptoms ever begin. In this video, I'm going to walk you through what your body may already be telling you through something you see every morning and almost never think twice about. You'll learn what normal stool actually looks like, which changes are usually harmless, which warning signs deserve attention, and why one particular shape is the sign I consider most frequently missed. Look before you flush. It may be one of the simplest health habits you've never been taught. Before we talk about warning signs, we need to establish something most people have never been taught. What does normal actually look like? Because it's impossible to recognize a warning sign if you don't know what normal is supposed to look like in the first place. And when it comes to stool, many adults have never been given that baseline. What you want to see most of the time is something that is formed, easy to pass, and reasonably consistent from one day to the next. Not too hard, not too loose, and not something that leaves you feeling as though the job isn't quite finished. Color matters too. In most cases, healthy stool is some shade of brown. That's usually a sign that several parts of the digestive system are working together the way they're supposed to. The liver, the gallbladder, the intestines, and the trillions of bacteria that help process what passes through the digestive tract. When everything is working as expected, the result is usually fairly predictable. A formed stool, a brown color, and a bowel movement that occurs without significant discomfort. That's your baseline. Because every warning sign we'll discuss today is really just a departure from it. A change in color, a change in consistency, or a change in shape, including the one specific shape doctors sometimes pay particularly close attention to. And once you understand what normal looks like, those changes become much easier to recognize. So let's start where most people first notice something is off. Not color, not shape, consistency. So what happens when consistency starts to change? This is often one of the first signs people notice, because even if the color looks normal and the shape doesn't seem unusual, the texture may begin to tell a different story. Let's start with stool that is unusually hard, dry, and difficult to pass. Sometimes it appears as small pellets, sometimes as hard lumps, and sometimes as a bowel movement that requires far more straining than it should. In many cases, this simply means the stool spent too much time inside the colon. One of the colon's jobs is to absorb water, but when stool moves too slowly through the digestive tract, it continues losing water and becomes drier and harder. That's why dehydration is one of the most common causes of constipation after 60. Low fiber intake can also play a role, as can certain medications that slow digestion. Now let's look at the opposite problem, loose stool or diarrhea. Most people experience it occasionally, and in many cases, it's temporary. But when loose stool becomes a regular part of daily life, week after week, that's different. Because persistent diarrhea suggests the digestive system has not returned to its normal baseline. And that's something doctors generally want to understand. The important thing to remember is that consistency changes don't automatically mean something serious is happening. Most don't. But they do tell us something about how material is moving through the digestive tract. And that's why doctors pay attention to them. Because consistency is often one of the first clues that something has changed. But consistency isn't the only clue. and the next one may be even easier to spot. Color. So, what can color tell us? Quite a lot, actually, because color is one of the easiest changes to notice. You don't need medical training. You don't need special equipment. You simply need to pay attention. Let's start with a color that worries many people unnecessarily. Green. In many cases, green stool is completely harmless. It can happen after eating large amounts of leafy vegetables, and it can also appear when material moves through the digestive tract more quickly than usual. Now let's look at a color doctors pay a little closer attention to: pale stool, sometimes described as clay-colored, grayish, or unusually light compared to what a person normally sees. Remember when we talked about healthy stool usually being brown? That color depends on bile, a digestive fluid produced by the liver and released into the intestines. When stool repeatedly loses that normal brown appearance, doctors often want to understand why. Another change people sometimes notice is stool that appears greasy, oily, or difficult to flush. This can occasionally happen when the body is not absorbing fats as efficiently as it should. And then there are two colors that doctors generally do not ignore: black and bright red. Black stool that looks tar-like, or bright red blood that appears repeatedly, are changes that deserve medical attention rather than guesswork, not because they always indicate something serious, but because they can sometimes be signs of bleeding somewhere within the digestive tract. The important thing to remember is that color changes are just one piece of the puzzle, but the next sign may be the one most people never expect, because it involves the one stool shape doctors often pay particularly close attention to: shape. So why does shape matter so much? To understand that, you need to understand something simple about the way the digestive tract works. Your colon is essentially a tube, a long tube that carries material through the final stages of digestion before it leaves the body. Under normal circumstances, that tube is wide enough for stool to pass through and maintain a fairly full, rounded shape. That's why a healthy stool often looks like a smooth log or sausage. The shape reflects the space it moved through. But what happens when that space changes? What happens if part of that tube becomes narrower than it used to be? The answer is surprisingly simple. What passes through it may begin to look narrower too. And that's why doctors sometimes pay close attention when stool becomes consistently thin, ribbon-shaped, pencil-thin, or noticeably narrower than it used to be. Now, it's important to be careful here. A single bowel movement doesn't tell us very much. Almost everyone experiences occasional changes from time to time. What doctors pay attention to is persistence, a change that doesn't go away, a change that continues appearing day after day, week after week. Because when stool repeatedly becomes narrower than normal, it may suggest that something has changed within the digestive tract itself. Sometimes, the explanation is relatively harmless: inflammation, scarring, or other conditions that affect the shape of the passageway. But in some cases, persistent pencil-thin stool may also be one of the warning signs doctors look for when evaluating colorectal cancer. And that's exactly why this particular shape deserves attention. Not because it automatically means cancer, most of the time it doesn't, but because it is one of the few changes that may occasionally appear before pain, before significant symptoms, and before a person realizes anything else has changed. That's what makes it so easy to dismiss, and that's also what makes it so important. But shape is rarely the only clue, and the next signs may be just as important. So what other clues sometimes appear alongside changes in stool shape? This is where doctors start looking at the bigger picture, because shape alone rarely tells the entire story. What doctors often pay attention to is whether multiple changes begin appearing at the same time. For example, some people notice they feel more tired than usual, not exhausted, not suddenly unable to function, just a gradual loss of energy that seems difficult to explain. Others notice changes in their bathroom habits, a feeling that the bowel movement isn't quite complete, or the sense that they need to go more often than they used to. Some people develop occasional abdominal discomfort, pressure, bloating, or cramping that wasn't there before. And sometimes, people begin losing weight without really trying, not because they're dieting, not because they've increased their activity, but because something has quietly changed. Now, it's important to remember that each of these symptoms can have many different causes. Most are not caused by cancer, and many turn out to be completely unrelated to the digestive tract. But when several changes begin appearing together, that's when doctors pay closer attention. Because the body rarely communicates through a single sign. More often, it leaves multiple clues, small clues, changes that seem easy to dismiss on their own, but become much more meaningful when viewed together. And that's why doctors don't just ask about stool shape, they ask about everything else that's changed too. Because sometimes the combination of clues matters more than any single clue by itself. And that raises an important question. At what point should you stop waiting and seek medical advice? So, when should you stop waiting and seek medical advice? This is one of the most common questions people ask, because nobody wants to overreact to a temporary change. But nobody wants to ignore an important warning sign either. The good news is that doctors are usually less concerned about a single unusual bowel movement and much more concerned about changes that persist, changes that don't go away, changes that become the new normal. Persistence matters. For example, if stool suddenly becomes pencil thin for a day or two and then returns to normal, that's usually very different from a change that continues week after week. The same is true for diarrhea, constipation, or any noticeable change in bowel habits. There are also a few situations where doctors generally recommend paying attention sooner rather than later. One is black stool that appears tar-like. Another is bright red blood that appears repeatedly. And another is a persistent change in stool shape, especially when it appears alongside other symptoms we've discussed today. Unexplained weight loss, fatigue, changes in bowel habits, or ongoing abdominal discomfort. Again, none of these signs automatically mean something serious is happening, but they do mean it's worth finding out why the change is occurring. Because when it comes to digestive health, answers are usually more valuable than assumptions, and that's why doctors would almost always rather evaluate a symptom that turns out to be harmless than miss one that wasn't. So if something changes and stays changed, don't ignore it. Ask questions. Pay attention. And if necessary, talk to a healthcare professional. Because sometimes acting early is the difference between finding reassurance and missing an opportunity to address a problem while it's still easier to manage. And that leads to one final question. What should you actually do if you notice one of these changes? So, what should you actually do if you notice one of these changes? The first step is simple. Don't panic. Remember, none of the signs we've discussed today can diagnose a disease on their own, and many changes in stool turn out to have completely harmless explanations. The second step is to pay attention to whether the change is new. Has it always been this way? Or is it something you've only recently started noticing? Because doctors are often more interested in change than appearance alone. A bowel habit that has remained the same for years may tell a very different story than one that suddenly begins to change, and especially one that stays changed. The third step is to look at the bigger picture. Have you noticed any other symptoms? Changes in energy levels? Unexpected weight loss? Abdominal discomfort? Changes in appetite? Or anything else that feels unusual for you? Because a change in stool may be far more meaningful when it appears alongside other changes in your health. And finally, if a change is new, persistent, worsening, or simply concerns you, consider discussing it with a healthcare professional, especially if it appears together with other symptoms. Because sometimes the most valuable thing a symptom can do is start a conversation. A conversation that leads to answers, reassurance, or, when necessary, earlier attention to a problem that might otherwise have gone unnoticed. The important thing is not to become afraid of every change you see. It's to become more aware of your body, because awareness is often the first step toward making informed decisions about your health. And that brings us to one final thought about what your body may really be trying to tell you. As we've seen today, your stool may reveal far more than most people realize, not because it can diagnose disease, and not because every change is a reason to worry, but because it may sometimes reflect changes happening elsewhere in the body. And that's why doctors occasionally pay attention to it. Not because it provides all the answers, but because it may sometimes provide an early reason to ask a question. And sometimes, asking the right question can make all the difference. Perhaps the most important thing to remember is that no single bowel movement can tell the entire story. Not one change in consistency, not one change in color, and not even one change in shape. What matters is the pattern. What matters is whether something has changed, and what matters is whether that change persists. Because that's often what doctors pay attention to most. Healthy aging isn't about becoming worried by every symptom. It's about staying aware, staying curious, and continuing to take an active role in your health. So the next time you look before you flush, take a moment to notice what you see. Not because you should be afraid, but because awareness is one of the simplest health habits we can develop at any age. And now I'm curious, before watching this video, had you ever heard that changes in stool shape, color, and consistency could sometimes provide clues about your health? Let me know in the comments below. And if you found this video helpful, don't forget to like, subscribe, and join us for more evidence-based insights on healthy aging. Thank you for watching, and I'll see you in the next video.